I call the member for Maitland and welcome her back.
Sorry about that. I was expecting another 2 minutes. Thank you, Mr Temporary Speaker. I'd like to begin my contribution today by saying thank you to everyone in my community, members of this House, and most particularly my family for the support that I've received, particularly over the last 2 months as I have been recovering from a mastectomy and reconstruction after experiencing cancer last year. And I wanted to talk, if people want to find out all the stories of that, go and look at my Facebook page, it's all good, it's all on there. But I wanted to talk about why I really want to raise this issue. I have been back at work for about 4 weeks now, and the other day I went to see a woman in my electorate who lives in public housing, and she's been battling housing over termites in her house for months and months and months. And it's got to the stage now where she doesn't even have power in her kitchen. So we went around the house, we looked at the mould that's still there after the April 2015 superstorms. And this single mother of 3 children then says to me quite sort of matter of fact at the end of this, I just need this to be sorted out before I go into hospital to have surgery on my cervical cancer. And to me, it just brought home the issues that we are facing in our community for women who are these sole breadwinners for their families, struggling with health, and particularly in regional communities. As this woman said it, there was another woman in the room, and she talked about a third woman who has just been diagnosed with stage 4 breast cancer, again a single mother, who was complaining that she had to pay for an MRI, this order of $500, and the implication was that if she had have known she was going to have to pay for that, she wouldn't have paid for it because her family would have been able to eat in the next fortnight and not go without groceries, which is what had happened to her. It was Women's Health Week from the 3rd to the 7th of September, and I must say that I believe the government was singularly silent this year on that issue. We have a crisis in regional areas of access to health. I was in Foster on the weekend. Luke Foley, the Labor opposition leader, talked about the fact that mastectomies are still not able to, are now no longer being able to be performed in that community. So women are having to travel 2 to 4 hours to get to places where they can get a mastectomy. I myself, for the surgery I had to undertake, had to come to Sydney to be able to get it done. And the state of public health in New South Wales is a disgrace. I spent 52 hours in St Vincent's Public Hospital Emergency Department after experiencing complications, in which time I wasn't fed for 16 hours. This was not due to oversight by the staff, just total lack of any resourcing. There was a duress alarm went off in the middle of the night on Friday night when I was in there. I didn't know where I could have a shower during a lot of that period. These are all awful things to be experiencing. And as a regional woman, having to do it without the support of family and friends because you have had to travel so far for medical treatment. Access to radiotherapy in my community, I've talked to women who've had to have that 3 hours minimum travelling time to go and get a 5-minute radiation. If you don't have someone who can drive you, add probably another 2 hours on that as you catch the 2 buses and have a 10-minute walk to get your treatment. The social determinants of health, transport, funding and stable work are not working in our regional communities for people experiencing health issues. Many members would know about the woman from the University of Wollongong that was in the paper recently. 4 days after her second mastectomy, she had to return to work because she was only a casual employee after 10 or 11 years of working at the university. The precarious nature of work, the fact that women are having to do the raising of children, raising of families, and catching these diseases in their prime, the lack of access to adequate screening, all of these feed into a very poor picture of regional, particularly health for women in our community. And I have to reflect, Mr Temporary Speaker, Labor has run a very successful awareness campaign about schools and hospitals before stadiums, but we need to be talking about the stories of the women who are suffering and the men in our regional communities, while this government is going to be building stadiums in Sydney that will not save anyone's lives. Thank you.
I'd like to thank the member for Maitland. We're hearing